Hey there! If you're aiming to become an infection control nurse, you're in the right place. In this video, we're going to walk you through some common interview questions and how to tackle them with confidence. Let's dive right into the first question. Can you share an experience where you had to explain complicated information to a patient or their family? How did you make sure they understood? This question is all about assessing your communication skills, especially when dealing with complex medical information. It's crucial to show that you can break down intricate details into something that's easily understandable. Let's look at some tips to help you craft a strong response. Start by describing a specific situation from your experience. Explain why the information was complex. Discuss how you simplify the details, perhaps using visuals or analogies. Highlight how you confirm their understanding, like asking follow-up questions. Wrap up with the positive outcome for the patient or family. Now, let's see how this could come together with an example answer.
In a previous role, I needed to explain a complicated treatment plan to a patient's family. I simplified the information into key points and used a straightforward chart to show the treatment stages. By asking them to summarize what they learned, I confirmed their understanding, which left them feeling much more comfortable and reassured.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for infection control nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you describe a successful collaboration with your healthcare colleagues on an infection control project? This question is designed to explore your teamwork and collaboration skills, particularly in infection control settings. It's important to demonstrate how you work effectively with others to achieve common goals. Let's go over some tips for constructing your answer. Pick a specific initiative you were involved in. Explain each team member's role in the project. Detail your contributions and the outcomes achieved. Emphasize the teamwork and communication strategies employed. Mention any measurable improvements or metrics. To give you a better idea, here's an example response.
In my previous job, I worked with doctors and nurses to launch a hand hygiene campaign. I led the education sessions on best practices and monitored compliance. Our efforts resulted in a 30% reduction in infection rates over 3 months, highlighting the success of our teamwork.
Tell me about a time you faced resistance from staff regarding infection control measures. How did you manage it? This question evaluates your conflict resolution skills and your ability to implement change. It's vital to show how you handle opposition and foster cooperation. Let's explore some tips to help you answer this effectively. Clearly describe the specific situation and resistance you encountered. Discuss the steps you took to address the resistance. Highlight the outcomes of your actions. Mention any follow-up actions to ensure long-term compliance. Here's an example of how you might structure your answer.
In a previous role, some nurses were hesitant to adopt new hand hygiene protocols. I organized a meeting to listen to their concerns and provided data on the importance of these measures. By addressing their issues directly, compliance improved significantly, and we saw no new infection cases that month.
If you were to design a training program for new nurses on infection prevention, what key elements would you include? This question assesses your ability to develop educational programs and ensure effective training. It's important to demonstrate a thorough understanding of what new nurses need to know about infection prevention. Let's consider some tips to build your answer. Identify essential topics like hand hygiene, PPE, and environmental cleaning. Include practical demonstrations to reinforce learning. Incorporate assessments to check comprehension. Ensure you include updates on the latest guidelines and practices. Provide resources for ongoing learning and reference. Let me share an example. Answer to illustrate this approach.
I would center the training on crucial topics like hand hygiene and PPE use, supported by practical demonstrations. I would incorporate quizzes to assess understanding and provide up-to-date guidelines as a reference for continued education.
How would you ensure the care and safety of a patient who needs to be quarantined due to an infectious disease? This question is about your ability to manage patient care under quarantine conditions, ensuring safety and communication. It's crucial to show how you maintain a high standard of care while following protocols. Here are some helpful tips for your response. Clearly, communicate quarantine protocols to the patient. Ensure proper PPE usage for both staff and the patient. Implement strict infection control measures in the patient's environment. Regularly monitor the patient's health and manage symptoms. Coordinate with the healthcare team for comprehensive care. Here's how you could frame your answer.
I'd start by clearly explaining the quarantine requirements to the patient and reassure them. I'd use appropriate PPE and ensure their environment is thoroughly sanitized. Regularly monitoring their health would be key, along with coordinating care across the healthcare team to meet all their needs.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.